I'm Lucy Johnston and welcome to Family Talk. This week, the government announced plans to recruit 10,000 more foster carers in England. With record numbers of children in care, a shortage of foster families, I'm delighted to be joined by Children and Families Minister Josh MacAlister to discuss whether red tape and outdated rules on both sides of the border are standing in the way of loving homes and what needs to change. So thank you so much for joining us today. The government has just introduced plans to recruit 10,000 more foster carers, and I'm wondering what the thinking is behind this and why fostering is better for children than care places in residential homes.
So the starting point for this is that every single child needs lifelong loving connections. They need people in their life who give them that sense of belonging, of rootedness, and that they've got a kind of tribe of their own. That is part of the human condition. And one of the struggles that the care system has when children can't live with their parents is that it often struggles to put those connections around children, especially in residential children's homes. And the situation we've got at the moment is because we're short of foster carers, children are forced to move around the country, often matched with foster carers where it's not the right fit, and children and foster carers suffer as a result of that. Now, across the whole of England, we've seen a 12% reduction in the number of foster carers at the same time as demands for foster care have gone up across the board. So what the government is doing is stepping in now to say we need to expand fostering, we need to get 10,000 more places in the foster care system so that children can have the choice about where they live.
How do you plan to incentivise people? We know that the wages for, or the money given is about £200 a month, and some people might say that it's just not worth it for them.
So the big thing we've heard from foster carers is actually more to do with the support they get and the frustrations they have with the fostering system itself. The reforms we're going to set out are all about changing that. And we also know that we're not short of people who are interested in fostering. So last year we had 150,000 people come forward, start the process, but so many of them dropped out because it takes too long, it's too bureaucratic. And then finally on fees and allowances for foster carers, I know that there's big variation across the country at the moment. And one of the things we're going to do as a result of the announcements today is do the thorough analysis of what's the differences in fees and allowances, and are there particular rates that retain and recruit at a higher level? And if we find that, we'll obviously be keen to spread that around.
To look at it. So you may look at that and it may be adjusted for some areas of the country.
Yeah, but the thing to stress is that it is up to local authorities what they pay, and of course they've got the trade-off at the moment as to whether or not they remunerate foster carers properly, or whether if they don't, they end up facing actually higher costs in children going to residential care. So it is a local-led system, but as national government, one thing we can do is get data really clear and then make sure we set the minimum floor.
But you're saying that this is what people believe, that's their perception, but what's the reality on the ground? Have people being quietly screened out because they vape, because they have? Then you've seen that.
Yeah.
So what's the most extreme examples of that? Have you actually seen that?
Well, when I did the independent review of children's social care, I met and spoke to families who had a chest freezer and were told that they needed to get rid of the chest freezer, otherwise they wouldn't be approved because a child might go into the chest freezer. And that, work that back, may have come from someone thinking actually something dangerous happened once with a chest freezer, so we'll create a rule around chest freezers. But if you keep doing that, you end up with a system that isn't human, that isn't common sense, and actually creates other kinds of danger because we don't have enough homes for those kids. I spoke to a colleague who is a member of parliament at the moment. I won't say who it is, but they told me that they applied to be a foster carer, and because they had a renovation going on in their house at the time, they weren't suitable to go through the approval process. Loads of people have got renovations going on in their house at any given time. So we just need to drop some of this stuff. Think, is this a family? Is this a person who can love a child and offer them a sense of belonging? And if they can, let's make the system work around them rather than making them work around the system.
Now, you've said that the numbers of children in care could rise from about 80,000 now to 100,000, costing 15 billion instead of 10 billion now. Are we still heading for that kind of cliff edge in cost and numbers?
Yeah, so when I set out the projections in the review that I published about 4 years ago now, we looked ahead for the next decade to say that if we weren't going to take action, we'd see more children in care and higher costs and worse outcomes. Now, the good thing is, partly because of some action that's already been taken and that the government is accelerating, so we're putting in £2.4 billion to reset the system, we are now starting to see, and it's very early, so I don't want to sound complacent in any way, but we are starting to see the care numbers settle at about 80,000. So they've actually come down very, very slightly in the last 2 years. That needs to continue coming down so we've got more children staying safely together. Where we've got a big problem is within care, we are seeing more and more children living in residential care. In England, it's almost double the rate that it is in Scotland. And that is more expensive and the outcomes are worse and it's draining money away from earlier support for families. And that's before we even get on to questions of profiteering.
There's a question around the private equity coming in and just making profits out of that, which is quite different from private care homes. Yeah. But would you be seeking to try and remove or somehow disincentivize private equity firms coming in to exploit the market like that?
There's a few things that we're doing. So the action plan that we're publishing today is entirely focused on boosting not-for-profit and public provision of foster care. So the 10,000 target is for 10,000 extra foster places in local authorities and in independent fostering agencies that are not-for-profit. Then in addition to that, in a couple of months, we'll be bringing in a market oversight mechanism to look at large private providers to see whether or not they are overly debt-laden and at risk. Right. That will also give us data on the level of profit making. And if we see profiteering that the CMA reported on a few years ago, we've got power now that's going through Parliament to put in place a profit cap. So there's a bunch of action we can take, but the best, quickest route to tackle this is actually to expand fostering in a big way.
Children in care, I mean, I think, isn't it about 2/3 of children in care have experienced abuse or neglect. Many of those are, become withdrawn. I'm just sort of wanting to move slightly on to another subject. We've got which you're involved with as well, the plans to have a social media ban for under 16s, Australia style. Now, many people say that will push them onto the dark web, VPNs. Why put the problem on children when it's a system that's been created by adults? Where are you with this?
Well, I've got a bit of a record on this, having brought a private member's bill to Parliament last year on exactly these issues, because it's a debate that's been raging in the country for some years now. The government have now put this issue front and centre in Parliament and in government as well. There'll be a big national conversation led by the government with a consultation, and part of that is putting on the table an Australia-style ban.
And what do you feel? Do you think that's a good idea, or do you think it could push them into the areas where we can't regulate it and it's too difficult anyway?
Well, look, we need to do the evidence gathering process to establish some of the answers to those questions. They're exactly the right questions to answer. The way I think about this is that we have over decades and generations established new social norms about what young people and children should and shouldn't be able to do, and the kind of rites of passage when you become a young adult, including smoking, drinking, driving. And in every one of those instances, there have been debates and concerns about whether it's going to have an unintended effect or push people, to buy cigarettes on the black market rather than in shops. And we've had to, through process and iteration, get to the right way of implementing those things. So I don't disregard those points, but in a world where there is clearly some harm here from very extensive screen time, doom scrolling, we have to set some new social norms. So the government have been clear colleagues in the Department for Science have been very clear that we are going to take action on this. We're going to do that, and we're going to set out the plans this summer. And one of the options is an Australia-style ban.
I was going to ask about the difference, or the way people can mistake neglect and poverty for poverty for neglect or abuse, and how children can get trapped up into the care system but wrongly. Do you think that's a significant problem? You've mentioned it in your report, I think.
Yeah, these are really big concepts. So the idea of neglect and how the state gets involved in a family where parents may really love their kid and may be able to provide a lot of the support and the foundation that they need to have a successful life, but where their home is damp and small, and where they don't have enough cash coming in, and where one or two more things may tip them into crisis. And that crisis is going to lead that child to not have a good enough life. And in those circumstances, social workers, on behalf of all of the rest of us, have to make some judgments about what intervention is going to work, what is just in terms of state intervention in family life. And the law is really clear on this, which is that we should only take children into care where there is significant harm. And there are...
Who decides what's significant, though?
Well, exactly. Well, the courts. And so there are...
The courts, do we have a problem with the courts? Do we have backlogs as well? Or?
We have backlogs. I mean, the public, we do have backlogs. But I think one of the strengths of the current system is the expertise of the judiciary. And actually, we've seen, an improvement in terms of decision-making over the last few years about some of these cases. But I think what's important to try and get a grip of for social work is, are we clear about the distinction between significant harm and neglect, and the role poverty may play in neglect, and the overlap when neglect is so severe it causes significant harm. And we've got to help social workers through great professional development and training and supervision to make good decisions about all of that. And I think if anyone in the public thinks it's all really straightforward and easy, I just kind of urge them to find a social worker, sit down and have a cup of tea with them, because it is really difficult.
How do you plan to improve that process and to move it from a crisis-led system, which you've often said people actually use the system when it's reached a tipping point and when it's awful? How can we improve that? I know expanding foster carers will mean that we've got more children in loving homes with their families.
So action on three levels. One is, as a country, we need to lift many more children out of poverty so that family stress is revealed. Well, we're taking two steps that will lift in this parliament alone 550,000 children out of poverty.
From the
two-child limit plus an extension of free school meals. Those two measures together, 550,000 children lifted out of poverty, which is the biggest shift in child poverty rates of any parliament on record in one parliament. At a system level for children's social care, the reforms that we're setting out are making local authorities spend more on intensive support for families before significant harm occurs.
And where does that support come from? You've mentioned sort of family hubs or family
help teams. Exactly. So this is saying to local areas, we want to see that families' needs are being met by teams of practitioners who've got the skill to just do the work rather than go and assess them and refer them on to someone else.
Money for those?
There is extra money for those teams. So £2.4 billion over the next few years. The programme's called Families First. And a big part of my job is making sure we implement that well and we get that system-wide reset towards earlier intervention. So there's a kind of societal level, there's the system level, and then the third one is at a practitioner level, where we need to do a much better job for social workers of giving them the early career pathway of intensive training based on evidence. What do they need to know and be able to do with a family to respond to significant harm, neglect, and family crisis. And we are going to be setting out very soon plans to improve that post-qualifying system. We'll put the money in to make that work, but the whole system relies on great quality judgments and decision making by practitioners. So we will prioritise that.
So you've talked a lot about it being a crisis-led system, and I wondered what you thought about how much instability in the care system is just the design itself, rather than the sort of needs of the children or increasing needs of children, and what other things would you look at down the track, sort of horizon scanning, to change that system?
So I think so many of the features that we see in the care system are the result of decisions being made to manage the anxiety of adults and professionals to keep them safe than to make decisions that are about the safety of children.
So, for example, what?
So, for example, we will make decisions to place a child in a children's home because they are at that moment in time in crisis. You know, they might have had a really significant incident go on. They might have got involved in a gang activity or run away. So it's a really difficult moment. And we are so panicked as adults, we make the decision to place them in a children's home.
Yeah.
Which essentially, in too many cases, not in every case, is essentially warehousing a child and keeping our anxiety lower. It doesn't solve the problem for the child. It doesn't address the things that drove them into the situation in the first place or made them vulnerable. You know, another example, we have lots of inspection and checking going on where we'll look at whether or not, you know, the door lock works, whether there's glass in the car park outside the children's home, whether or not the foster carer has got a chest freezer. We look at all of that. We do not, and this is a massive gap, we do not check whether there are people in that young person's life who love them. So we can make the system feel really safe for us and then leave children at the centre of it, isolated, lonely, and not feeling that sense of belonging. And that is fundamentally what we need to shift.
How can you change? I mean, I've spoken to lots of people that work, you know, run care systems. The amount of paperwork, you will know this more than anyone, that they have to go through for everything. I think there was someone I talked to they had a 16-year-old and they wanted to go out and sit on the park and have a drink, you know, for the vet. And well, you have to fill this form, this form, this form. It's not looking after the children first. It's looking after to the box ticking. How can you strip that away? We have all these layers in place, you know, one after the other. Have you got any way of undoing that? Because it's all entwined, isn't it?
It is, and it keeps getting worse. I mean,
well, the more, another layer, and then another, never take them away.
Yeah. And I described this in the review as building a pile of Jenga, and the system just keeps adding bricks on, and the system actually then becomes really rigid and very vulnerable.
And how does that affect children?
Well, yeah, exactly. It limits our ability to respond to their needs because of our needs to meet the expectations the system has. So the first thing is, do we have people in government who share that analysis? Yes, because that is my analysis. And it's why in the consultation we're publishing today, which will only go on for 6 weeks, so we're going to move at pace, there are measures in there and measures in the call for evidence that we're publishing today on fostering, which are about removing unnecessary bureaucracy. Right. Now, I'm sure that in doing that, there will be some concerns and some anxiety about how we make sure the system remains safe. Yeah. But we have to get into this space of having fewer but better rules, where we trust and expect more from practitioners. And if they don't meet those expectations, we hold a higher bar about what we expect, rather than just governing everything through compliance and rules. Ofsted need to be realigned with those expectations, and they're on board with that journey. And I've had lots of...
Who would be imposing, or who would be changing the system? Who is responsible if you did want to look at some of that regulatory framework? How can you strip it away? You're looking to do that.
Well, lots of that is down to government and Parliament. So
it'll be through parliamentary process.
Exact statutory guidance, regulation that we have in place. We're consulting on whether panels that are used to approve new foster carers, is the resource and time that they take up commensurate with the value that they add to the process, or should we use that resource to do something else?
To look at potential foster carers?
Well, so it's a good example because we already have, for someone to go through an approval process to become a foster carer, they'll typically have 40 to 50 hours worth of interviews over a series of months, which is right and proper. Really get into their background, Have they got any ideas about family that may be a bit worrying?
You would no longer screen out single parents working.
But we wouldn't screen out people for those reasons.
No, but are they at the moment?
In some cases,
Okay.
not always, but
you're trying to reform that. Yeah.
we're reform that at the front door. But the process when they go through to get approved, there are things you want to keep. But at the moment, you've got a very lengthy assessment process, which is right. You have a social worker that does that. You have a manager supervising the social worker. You have Ofsted overseeing the service and checking through inspection. You then have an agency decision maker, which is a designated person who makes that decision about whether to approve. And then on top of that, you have a panel, often of local councillors or other people, who then make the final decision. And we see that panels can add weeks and in some cases months to that process. They approve 98% of the applications that go to them.
Right.
And I'm saying, is that worth the time and money in the process? And we're asking that question.
Up to 3, 4, 5 months.
If you have panels meeting only at set points, one of them gets cancelled, you could end up having a really great foster family waiting there.
So how long have you seen?
Well, for months extra.
Yeah. Oh, yeah.
In most cases, it's an extra few weeks, but it can be months. And if you take that all together across the country for everyone we're trying to approve, if that means we've got fewer foster carers, is it adding or taking safety away for children?
The net gain,
Exactly. Think about the trade-off. So I guess it's a micro example. We're doing a consultation on it at the moment, so I'm keen to hear from people's views on it. But it's an example of the fact that we are stepping into this space now of asking, is in some cases, is less going to provide more care and love for these children by putting the focus on the things that really matter most.
But what about in the care home sector? That's quite different. There's also a huge regulatory pile up there. Are you looking to reform that too?
So my focus has been from the get-go on fostering. I'm really pleased we've got the plan out now. I'm going to keep on at that with like a dog with a bone to make sure we hit the targets of 10,000. I've got the Families First programme, which we're going to be implementing, and I'm going to be, again, gripping that and making sure we get involved in local authorities where it's not being rolled out. But I am now able to spend a bit more time, and I'll be setting out a little bit more detail in the next few weeks about residential care.
Yeah.
I am really interested in the workforce issues because that's been neglected for a long time.
In what way?
Well, we have no real ambition about what we expect people to know and be able to do in residential care. What is it that we want the people that work in these children's homes to be able to offer children? We often talk quite broadly about therapeutic children's homes, but what knowledge and skills should they have to provide that support?
Do you think there's a vacuum in some areas for children in the children's homes? And what is it?
Massively. I mean, if you look at, the vacancy rate of children's home managers is extremely high across the country. So we've got children's homes that don't even have registered managers in them. Staffing structures where children's homes are really struggling to recruit and the rate of pay is very low.
That affect children. And do you think there's also a vacuum in their needs being met for any reason?
Well, it directly affects children because they are being sent to live in children's home, usually when you look at the care plan on the basis that it's going to provide a therapeutic intervention, and you look at actually who's working in the home, these are people that have not been given the training and support to be able to provide that kind of
what kind of things
care.
Have you seen in your work?
So there are some amazing children's homes out there. Mulberry Bush Children's Home have got...
On the negative side, obviously don't name them, but what kind of things have you seen that are lacking for children? Because I know you said that they were set up at a time, for looking after children who've been neglected or potentially abused, but not dealing with the problems of today, county lines, drugs, things like that.
So look, I think in children's homes where they're not providing what residential care needs to offer, you have essentially small accommodation that is offering containment for children, containment of adult anxiety.
Yes.
You've got staff who are paid pretty poorly. They could earn more if they went to Aldi. And as a result of that, staff are churning over at a very high rate. So there's no meaningful relationships between staff and children. The number of staff mean that you've got who are working on a duty rota means that actually knowing whether that child, when they've come through the door, has had an appalling day and something awful has happened to them, or whether they've had a really good day, there's no way they'd be able to tell that, which, I mean, that's a really worrying thing, right? And the home doesn't have a permanent, stable leader because, I think, I can't remember the latest figures, but when I looked at it in the review, it was something like 20+% of children's homes don't have a registered manager in them because they haven't been able to recruit. So you take all of that together, it's no wonder residential care is struggling to provide the value in the system that it needs. And I want to make sure that when residential care is used, it's really purposeful. It's about a therapeutic process to get a child back to a family-like environment. And as I say, there are some really stellar examples of that, but they are very clear about the purpose, the training that's needed for staff, and who they recruit.
What do you see for the wider role of extended family, kinship carers? Do you think we're falling short in encompassing those people?
I think historically we have fallen short, but it's changing really rapidly. We've seen increases in the use of kinship and connected foster care in the last few years. Post my review, not entirely down to my review, but the policy space has got much busier, and there's a real interest in kinship care as a route for many more children. And on the ground, practically, we are now rolling out across the whole country, and we're legislating for this at the moment, family group decision making. So a process where before you go to court, you get the whole family, everybody, distant relatives, maybe some neighbours, you get them around the table and say, have you got a better answer than the system does for how we look after Johnny? And if you've got a better answer, why don't we go with that? And we're making that the default process in every case. I'm going to be tracking local authorities to see how many of these families get through a family group decision-making process, a family group conference. And then after that, I want to see many more family networks resourced and supported by local authorities, because I know that there's so many kids that I've met, or young adults that I've met who've grown up in care. They knew their aunt was on the scene, but no one had bothered to ask or bring them into the equation. And it can be such a better and lasting option for raising that kid.
Do you feel that the numbers of children in care could be dramatically reduced were we to look after people earlier on with primary prevention and all of those things? But, I suppose it's difficult to answer, but by how much? And is there any metric anywhere else or in previous times that you could somehow make an estimate of that?
Well, I mean, one thing you can do is you can look at local authorities where they've done a really good job of helping families earlier on, making sure that kinship care is used well, making sure they've got good options in foster care, that they do reunification where that's an option if family circumstances have changed, they go back home, and limited purposeful use of residential care. In parts of the country where they've done that, it is a completely different picture. And if you applied that across the whole of England, you would see numbers quite a lot lower than they are at the moment. And that really is the goal. If it's safe to do so, children should be with families. In the review, we looked at the do nothing scenario, which would see us hit 100,000 kids in care by 2032. And we looked at the counterfactual. If we did a big comprehensive reform programme, like we're now doing in government, we would see that number, the counterfactual, I think it was go to about 70,000, so lower than it is at the minute. There's lots of variables in that, and obviously the further you look out, the less reliable that data is. But what is true to say is if we did it in the places that are best, we spread it to the rest, care numbers overall would go down.
And what about the care leavers? There's a lot of criticism, and maybe that's not in the remit or not something you're looking at, but a lot of criticism once you leave care, once you hit 16 or 18, you're just there sort of, rudderless and abandoned. How do you feel that needs to change, and what are your plans, if you have any?
Well, so there's action that we've just taken in the last few weeks. Right before Christmas, I was really pleased to work with the Department of Health to announce that we're rolling out universal free prescriptions, dental care, eye care for care leavers up to 25. There's practical things like that we can do, and the government is rolling out more and more of those things all the time. I think for me, the big measure is, does care, that period of being in the care of the state before you hit 18, does it build rather than break relationships? And in building relationships around these young people, and I don't mean with professionals wearing lanyards, I mean with people who are in these young people's lives who they know, like, really like them and care about them and love them. If you are leaving state care at 18 and you've got practical support around you, but no one who loves you, you are snookered. That is the reality. And that's where the abandonment comes in. So for me, the obsession of care and leaving care must become, does it build lifelong loving relationships? And the great thing is, we know that there are programs and interventions that we could roll out and expand that would do that. So part of my job is figuring out, how do we shake up care and leaving care as a system so that it is obsessed with lifelong loving relationships? And if we can do that, then we don't have, young people in care feeling like they're alone at 21, 22, or even 30, but they've got their own tribe, which is not the state, it's not a service, it's their people.
Yeah.
And that's what everyone wants.
Yeah. What do you see, and I'm conscious of your time, but like how do you measure success? Like, what does that success look like? And that can be the last question. That if these reforms are successful, where do you look 5 years' time? What do you think the system will look like differently? And how do people know if they go into it that it's going to be different?
Well, I mean, the most obvious one is that in a few years' time, we've got 10,000 extra places in foster care. We've put that figure out there really clearly.
Well, bravely as well, but you're confident.
We've put our colours to the mast on it. Right. Yeah, absolutely. If we have not done that, I will not have done my job well. We have to reverse the decline in fostering numbers, and we have to really, really push for that, because the consequences every day are children waking up in children's homes or being forced to leave their school after all of the other disruption and trauma they've suffered, because we just haven't sorted the system out.
So having to move further away.
Yeah. So that's kind of an obvious one with a clear numerical figure on it. Yeah. But in looking at the system overall, it would be better if more money is spent on family support early on and less on care. If we kind of shift the balance in the 5-year period, we should reverse the steady increase of children coming into and staying in care. So those numbers should go down because more families are staying safely together in the country. And for care and leaving care, we should see many more children hit 18, hit their 18th birthday, and be able to say, I've got at least 2 people in my life who love me, if not a full tribe. And I think there are ways that we could measure that, and I'm interested in finding ways that we can.
Just last thing, but how can you measure, how can you know that the changes to the system, having people, the foster carers and having, that works? It's not been trialled. If you sort of mean, you're saying that you're going to do all these things, but you haven't got the evidence that it will work. How do you know it will?
Well, on fostering, we rolled out fostering hubs, this sort of idea of bringing local authorities together last year.
Family support as well. That's is that evidence-based?
So exactly. So everything that we're proposing to do is built on the existing good practice that's out there in the system. I've seen that through the existing fostering hubs that just do the kind of beginning bit of the recruitment process, if they pick up the phone to an initial inquiry straight away, if they go and do a home visit really quickly, if they connect an applicant with an existing foster carer as a buddy, just those 3 things, the application numbers go through the roof, and we get hundreds, if not thousands more carers. So there's kind of, you're right to ask the question, but this is not a pipe dream. These are tangible plans built on years of experimentation and testing, and it is now time to act.
If you'd like to hear more episodes, explore upcoming live events, or access free resources, you'll find all the links in the episode description. Just scroll down wherever you're listening.